Hello and welcome to your phlebotomy course. We are going to go ahead and start with our introduction to phlebotomy. These next couple of slides are just your learning objectives that I will let you read through on your own. So, what is phlebotomy? Essentially, it's the practice of drawing blood. So if you look at the Greek words and the roots of how this word was formed, phlebos means vein and tomy means to make an incision. So put those together, you're essentially just making an incision in the vein. So some more history on this. So in Europe, during the Middle Ages, barber surgeons actually performed bloodletting to help balance the four humors or bodily fluids because an imbalance of the humors was thought, at that time at least, to underlie disease. The familiar stripes on the barber's pole date back from this period, with the red symbolizing the blood and the white symbolizing the bandages. Also, phlebotomists used to apply leeches to patients' skin for hours at a time to help remove blood. Today, removal of the prescribed volume of blood, or what we call therapeutic phlebotomy, is used to treat a small number of certain blood disorders. So they weren't too far off thinking of removing blood for certain ailments. So today, phlebotomy looks a little bit different than it did back then when they were using leeches and having barbers let blood go. So the modern phlebotomy, essentially, you have job skills and training that need to be completed, which is why, you're taking this course. So generally, you have to have a high school diploma or GED to enter into a phlebotomy training program. You will learn technical knowledge. You'll need to have organization and ability to prioritize multiple tasks. So multitasking needs to be there for you to succeed in this. You need to have good attention to details, good interpersonal skills, since you will be communicating with patients, their families, nurses, doctors, other lab personnel. You're kind of the face of the lab out there. You're also going to have the ability to deal with difficult patients. If you think about it, sometimes when you're in the hospital or as an outpatient coming in for a blood draw, you may not be feeling the best, right? So they may not be the happiest person when you see them. So you need to be able to know how to handle those types of patients. And you also need to be able to handle stress well, too. Job duties of a phlebotomist. You're going to be collecting blood samples according to the procedures within the laboratory that you are working in. You're going to make sure that you can adhere to safety and infection control regulations, not just for patient safety, but for your own safety as well. Making sure that you can effectively interact with both patients and healthcare professionals, and making sure that you do that appropriately and professionally. Making sure that you keep accurate records of your blood draws and basically anything else that you need to record, which you will find in the lab where we document a lot of things. So you'll find that out throughout this course as well. And also making sure that you're knowledgeable of the computer operations of the lab. Lots of times that is where that documentation is going to occur. Also making sure to develop other healthcare skills that are needed for day-to-day patient care in your job setting. So depending on where you end up working, you may be doing more than just drawing blood. So an example, when I was doing phlebotomy as a job, I also did EKGs. So that was kind of another skill that I learned on the job that we didn't necessarily teach in the phlebotomy course. Personal characteristics that you will need to have for this position is dependability. Obviously, it should be pretty common knowledge that you need to make sure that you report to work on time and you avoid absences and tardiness as much as possible. Of course, things happen, you get sick. We do not want you to come to work sick, but we also want to make sure that when you're scheduled, you do come, not just for yourself, but making sure that your coworkers and patients have a safe environment as well. You also need to make sure that you are honest and have integrity. So report errors when they are made. So things happen, right? We need to make sure that we can talk about it and report it because that's how we are going to learn from our mistakes. It can be scary sometimes to, tell on yourself, but you need to make sure you do it because in this type of position, it really could be life or death. You draw the wrong patient and you realize that after the fact and you don't tell anybody, that patient could receive medication and, potentially die or have adverse effects on that. So that's kind of where that comes into play. You need to make sure that you can do that. need to maintain a positive attitude and try to make others around you feel positive as well. Sometimes you will have some sad or angering experiences, working with the public and patients, like mentioned earlier, sometimes they're not feeling the best. So that kind of makes them angry. So just try to maintain a positive attitude as much as possible. And on the same lines of that, also, have some empathy and compassion as well. Try to be sensitive to the patient's concerns and reassure anxious patients as well. Some of you, probably at least, aren't a huge fan of getting your blood drawn. A lot of people are scared of needles. So just kind of being there, making sure you can comfort them and have some compassion towards them as well. Let them know that it'll be quick, it'll be, essentially painless. They might feel a little something, but it shouldn't be too bad. So just kind of things like that, making sure that you're making them feel comfortable throughout the entire process. Some more personal characteristics, having professional detachment. So make sure to be sympathetic and understanding, but also try to retain professional distance to do your job efficiently. It's kind of hard to get attached because that can maybe sway you to do things that you wouldn't, morally or ethically do otherwise. Making sure that you maintain a professional appearance, have a good cleanliness and grooming, and also having interpersonal skills, so learning to communicate effectively with your patients and coworkers. Telephone skills. You will be answering telephones in this position, I'm sure. So making sure that you answer the phone promptly. I'm sure most of you have called somewhere and the phone just rings and rings and rings and rings. So that gets you a little frustrated, right? So making sure you on the other end of that actually, are helping that situation and answering that phone call. Smile when speaking. I know that kind of sounds silly, but it does. It makes your tone a little better, and it makes you seem helpful. And you just overall have a better mood when you do that as well. When you answer the phone, make sure you identify the department and yourself and ask how you can help. So, good morning, this is the lab, and you say your name and then ask, how can you help? That just helps to ensure that people know that they called the right place, first of all, and second, who they're talking to. So just kind of some, upfront communication with that. And then make sure to write everything down. So when you're answering the phone, make sure you write down the name of the person who's calling and the phone number as well. And then date and time of call as well, because that will help to be able to track that person down if we need to get a hold of them again. When you're on the telephone, make sure you speak slowly and clearly. Sometimes it gets a little difficult on the phone, especially if you're just talking. You can go super fast and you may not be able to enunciate what you're trying to get through, and that can be difficult for some people, especially elderly people who maybe can't hear that well. So making sure you're speaking slowly and clearly. Make sure you ask questions if you're not sure what the caller means. Sometimes people call the lab and they themselves don't really have the right words to know what they're trying to ask. So it's difficult to try to interpret, like what they're actually wanting. So ask questions, you know, try to figure out what they're actually needing and making sure you understand what they are needing as well. Do not put people on hold until you determine it isn't an emergency call. So an example is phone rings, you pick it up, say, one on hold, or something like that. You want to answer, make sure it's not an emergency first. And if it isn't, then you can say, I'm going to place you on a brief hold, go back to doing what you're doing if you're on the other line, and then come back to them. But, obviously don't make them sit too long either. And then only give accurate information. So if you don't know the answer to something that they're asking, that's okay. Say, I don't know, and find somebody that does. It's better to be honest than to try to, make yourself feel better and, be like, hey, look, I know everything. It's okay not to know everything. So just keep that in the back of your mind when you're talking with patients or healthcare professionals as well. There are some legal issues in phlebotomy that you need to be made aware of, and we will discuss some of these more in the next module as well. So this is just kind of a brief overview. But essentially, there is informed consent. So a patient must be informed of intended treatments and their risks before they are performed. So the patient always has the right to know who you are, where you're from, and what you are there to do. So a lot of times, when we go to a patient room, we'll say, my name, I'm here from the lab, and I'm here to draw some blood. And then the patient does have the right to refuse. They can refuse any and all medical treatments, including phlebotomy procedures that are requested by the physician. So if that happens, because you will eventually at some point run into this, you will follow your institution's policy so that the physician is notified, promptly. So lots of times that will take, you'll go to the nurse and then they'll contact the doctor. And then the doctor will then either have the nurse communicate with the patient, the importance of getting their blood drawn, or something, they'll try to remedy it. But as far as our side goes, if the patient refuses, don't try to talk them into it. Just say, okay, because that is their right. And then just let the nurse or whatever your institution's policy is for that, nurse, doctor, whomever, let them know and let them follow up on it. There also is confidentiality in the lab, so all information with the patient's condition, test ordered, results, any of that is confidential, and it is actually protected under HIPAA, or the Health Insurance Portability and Accountability Act, which is a law that actually requires procedures to be in place to protect the privacy of patients' protected health information, or PHI.